The Model Systems Knowledge Translation Center presents Alcohol Use After Traumatic Brain Injury. This slideshow is based on research conducted by the Traumatic Brain Injury Model Systems and serves as a resource for individuals with traumatic brain injury and their supporters. The Model Systems Knowledge Translation Center is funded by the National Institute on Disability and Rehabilitation Research. This presentation summarizes the research on the effects of alcohol on survivors of traumatic brain injury. The information can help people with TBI and their caregivers make decisions about drinking. What is the relationship between drinking and traumatic brain injury? Alcohol use and TBI are closely related. Up to 2/3 of people with TBI have a history of alcohol use or risky drinking. Between 30 to 50% of people with TBI were injured while they were drunk, and about 1/3 were under the influence of other drugs. What are the effects of alcohol on individuals with traumatic brain injury? Drinking after TBI can increase your risk of further poor health. Many TBI survivors notice that their brains are more sensitive to alcohol than before. Alcohol's negative effects can linger for days or weeks after the last drink. For people with TBI, even 1 or 2 drinks can be unsafe. In their first year after injury, traumatic brain injury survivors are 8 times more likely than the general population to be diagnosed with depression. Alcohol is a depressant. Drinking after a traumatic brain injury could therefore increase the risk of depression. Alcohol can reduce the effectiveness of many frequently prescribed medications, such as antidepressants. Alcohol can dangerously magnify the effects of other medications, such as anti-anxiety medications and painkillers. Many people have died due to alcohol-related drug interactions. Alcohol also affects sexual desire, and it can lower production of sex hormones and negatively influence sexual performance and satisfaction. People with a traumatic brain injury are at increased risk of seizures. Since alcohol lowers the seizure threshold, drinking can lead to increased risk of seizures. Recovery from TBI takes much longer than previously thought. Healing could last for years. Alcohol may slow down or stop brain recovery. Compared to the general population, TBI survivors are 3 to 8 times more likely of having another TBI. Alcohol, which impairs cognition and balance, can further increase of TBI survivors' chance of re-injury. How to manage drinking after traumatic brain injury. Given the risks, there is no safe level of alcohol after TBI. Many people with TBI want to stop or reduce their alcohol consumption. Key ingredients to successfully changing drinking habits are: find people, family, friends, and others who will support efforts to curb drinking. Set a specific goal. Make clear how that goal will be met. Identify situations or emotions that trigger drinking and find ways to cope with these triggers beforehand. Provide rewards for meeting goals. Don't underestimate one's ability to change. Some tips on what to do if you would like to consume alcohol after a traumatic brain injury are: have food and water before drinking. Have beer rather than liquor. Use water rather than soda as a mixer. Sip slowly and have no more than 1 drink every hour or 2 drinks every day. Take vitamins B1, thiamine, B2, riboflavin, or B9 folate. Never drink and drive. Take drinking holidays as reminders of the benefits of sobriety. Family members can have significant positive influences on a loved one's drinking habits. Stage an intervention. Go with a loved one to his or her treatments and meetings. Learn about the community reinforcement and family training or CRAFT model, which is far better than other approaches at getting people into treatment. For more information on alcohol use after a traumatic brain injury, take a confidential online drinking assessment. Consult with a physician or TBI rehabilitation staff member. For help, reach out to the Substance Abuse and Mental Health Services Administration, which is a federal program that can help one locate a treatment facility. For more help, consider Alcoholics Anonymous meets in most areas and has helped millions overcome alcohol dependence. Moderation, management, and smart recovery are alternatives to Alcoholics Anonymous that do not use 12-step model. There are many options for private treatment. Look in the yellow pages under listings like addiction treatment or chemical dependency counselor.